Hey friends, I'm so glad you found me. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in just about everything that I do. Each week, I'm bringing you physical, mental, and spiritual ways to heal your pain. Today, we're talking about your hips and how the tightness in your hips can affect your back pain. Almost all the patients and clients that I work with have restrictions in their hips, and it absolutely affects their back. So today we're going to talk about why the hips are tight. We're going to talk through some ways to assess whether or not your hips are actually tight, and then I'm going to share some ways for you to begin to loosen your hips, to take some tension off of your back and heal your pain. So first of all, why are your hips tight? Well, one of the main reasons physically is that most of you during the day, you're sitting. And so in this sitting position, we're in a flexed position of the hips, and 8 hours of sitting or more a day can absolutely start to cause some tightness in the front of your hip. So the other reason is more of an emotional reason, and it has more to do with what you're doing while you're sitting. The hips are right in between the legs and the torso. And so our legs represent the work that we do each day. They take us out into the world so that we can do our work. Our torso represents more of who it is that we are, who it is that we're supposed to be. And so when our work does not represent the best of us, the best of who you're supposed to be, then the hips begin to get tight. There's a muscle that's also very related to this emotional health, and it's the psoas. You spell that P-S-O-A-S, the psoas muscle. And where it attaches into the spine is really close to our respiratory diaphragm. And so when you're doing your work on a day-to-day basis in that sitting position, or if you don't sit a lot, when you're doing your work and you feel that stress from a conversation with a colleague or more work that you need to do or a deadline or whatever it is, all the reasons that you feel stress on a day-to-day basis, that stress restricts our breathing subconsciously. And we begin to not really descend that diaphragm and take those nice big breaths. And so when your breathing is restricted, your psoas, that muscle, also becomes restricted, and it relates to the tightness in the front of the hip. So there are both physical and emotional reasons why these hips get tight. And so you need to really think about both of those. So let's assess whether or not your hips are tight. So now you want to get a chair and put it in front of a mirror so that you can look at the position of your legs as we assess the mobility in your hips. So you want to sit back in your chair, be supported in your spine, keep your spine upright. Don't let yourself slump in the chair as we're testing the motions in your hip. So the first thing you want to do is cross your right ankle over your knee, and you're going to look at the angle that your lower leg makes with the floor. And you really want to see a nice parallel line between this lower leg and the floor, or perpendicular between both lower legs. This is external rotation, so you really want that whole leg, that whole hip to roll outward. And then you're going to assess the other side, and you're going to look for comparisons side to side also as to reasons why you might have pain on one side versus the other side of your back. And so when you look at the angles, you can see that this leg, my left leg, is a little bit tighter in my hip. It doesn't roll out quite as much to give me that angle. But many of you will be in this position. You won't be able to let that knee and that thigh roll out at all. So paying attention first to how much motion you have, you want this much motion, and then the comparison from left to right. So that's external rotation. Grab a pillow or a yoga brick will do, something that kind of keeps your knees apart. You want your knees in line with your hips. And you're going to kind of squeeze those knees together, and you're going to move the ankle away from midline. So just allowing that thigh to roll in as the ankle swings out. And so the angle that you're looking for here is about a 30-degree angle. So straight out is about 90 degrees. Midway between that is 45. So you're approaching that 45-degree angle with the lower leg in relationship to the other leg or from where you started. And again, you want to compare right to left. I don't have a mirror, so I can't really see, but they feel a little bit different. Like I can see this foot. They're almost the same, but that's internal rotation. Again, just another motion of the hips that may indicate some tightness. And again, looking side to side. The other motion that you want to look at is in standing. So you're going to go ahead and stand up. Again, using the mirror, and look at a line from the torso to the top of the thigh. Kind of an imaginary line, middle of the thigh, middle of the torso, and just look at the curve in your low back. The next motion that we want to look at is hip extension. So if you stand with 1 foot forward and 1 foot back, this allows the hip to go into some extension. So that midline of the thigh is now backwards or at an angle in relationship to the midline of the torso. But you shouldn't have too much of a change in the arch of the low back. So you want to kind of anchor down that tailbone and just assess, how does that feel in the hip when you bring that leg back? And if you notice that your back really goes into an arch as you step backwards, that may be some of the reason why you have back pain. And every step you take, that leg, ends up behind you. And if that sends your back into a lot of arch, that might lead to some excessive loading and some pain in your back. So assess the other side, step back with that left foot, and kind of see, how does that feel? How does that look in the mirror, this line to the line of my thigh? And then how does that feel? Do I feel tightness in the front of the hip? Do I feel some sensations in my back? All of those are just some clues about how tight your hips are and how that motion in your hips affects your low back. And so now, what can you do about it? So there's 3 strategies that I want to talk about in giving you some ways to deal with this hip mobility. First of all is during the day, you need to move more. Find opportunities to do the pelvic tilts. Stand up, take a walk, anything that will keep those hips moving. It will also help you to take that little bit of a mental break. The second thing is you want to train your core. So I've got some other videos that really talk about how to train the abdominal core. If your abdominal core is not strong, then those tight hip muscles are always going to pull your back into that arched position, which leads to that excessive loading and sometimes to pain. So you need to get your core strong first. And then the third thing is I'm going to give you 2 very specific exercises to work on to get yourself some support through the hips and then to open those hips up, especially addressing that iliopsoas muscle. So, on your back, you're going to roll down on your back and we're going to do a bridge exercise. So the feet or the ankles are underneath your knees. You kind of want to walk them back. Maybe you can touch your fingertips towards your heels. That's a nice starting position. Hips, knees, and ankles are all in alignment. Have some separation between those knees and those feet. Press your hands down into the mat. Ground into your heels. Squeeze your bottom and lift your hips.
feel the effort in those glutes as you squeeze and lift the hips. You want to lift as high as you can, but still stay comfortable in the small of your back. You want to feel comfort. And you want to hold this position several breaths until you feel some fatigue in those hips. You might start to shake as an indicator that you're feeling fatigue, but really feel that effort. You might feel your abdominal muscles engage a little bit during this exercise. That's good too. So holding those hips up there till you feel like they're fatigued, and then setting them down. You can do a few repetitions of that very exercise. I like the up and hold so that you can really feel like you're using those glutes. So the second exercise is more about stretching or gaining mobility. So you want to come to a half kneeling position. You might want to put some blanket or something underneath your knee so that you pad that knee, pad the shin. And you may want to have the chair or something beside you for balance. You want to feel really supported in this position. So similar to what we did in standing, we're going to try to stretch the front of this thigh and the front of the hip. But we have to activate those abdominal muscles first. So tighten through the abdominal muscles, squeeze in that bottom to drop the tailbone down, and then shift the weight forward so that you feel the stretch right in the front of the hip. You don't want to feel it in the back. You don't want to allow that low back to arch while you're doing this. And then you want to make sure that you take those nice big breaths, recognizing the relationship between that psoas muscle and your diaphragm. Just take nice big breaths. And then you switch to the other side. Again, anchor that tailbone down, stabilize in through your core, and shift your weight forward. Nice big breaths. You want to make sure that you feel it in the front of the hip. If you feel it in your back, just shift your weight back and readjust, and maybe don't go so far forward. Don't expect that you can get a lot of motion at first if those hips are really tight. You can keep easing into that stretch, but you want to make sure that you hold it anywhere from 5 to 6 long, deep breaths, or about 60 seconds. Now, how many times do you want to do that during the day? You sit for 8 hours or more during the day. So if you're really trying to get ahead of the mobility in your hips and move it in the right direction, you may need to do that a couple times during the day. If you can take that break during the day, integrate the movement, also then do this stretch. There's so many more things that you can do, but I want to just get you started on a few things. I also have an entire yoga series for you to try. It incorporates the abdominal strengthening exercises, the back strengthening exercises that we've done, the bridging, and the stretching. And I'm offering that to you as a free download, so you can find that below in the show notes and also on my website when you look at this video on my blog, in the blog area of my website. So if you have found something interesting today that you would like to share, maybe with your colleagues that you're sitting beside or your family and friends, please share it out. Like this video, subscribe to my channel so that you can keep getting information each week about how to heal your pain. I'm Stephanie Carter Kelly, yoga physical therapist. Namaste.